Hi, and welcome back to Girl Talk. We're here at the fabulous Pink Poodle on Odana Road, an awesome place to come and get whatever you need. But with us first is Dr. Amy Surgeon from Excellence in Dentistry, our favorite dentist. Thanks for being here.
Thanks for having me.
So
last
time we talked about that CAD/CAM crown making machine.
We did.
But you've got a cool new story to share with us.
There was a story on the news about a Danish zoo that one of the lions there, a 12-year-old African lioness, had broken her tooth and needed a crown. So basically, they used this technology, the CAD/CAM CEREC machine, to restore the lioness's tooth so that
that is incredible. So it's probably a lot easier. I mean, do they have to put them under, or that's the
yeah?
whole
Oh,
point?
Absolutely. So the African, yeah.
I would think. Yeah.
I hope so. Yes. So the lioness was sedated, and the important thing was that this was done quickly, and that's really important, evidently, for an animal of this size to have really short-term sedation.
Sure.
So the technology of the CAD/CAM CEREC machine helped to do that.
How cool.
I gotta say, I'm listening to your story and you say zoo and I was like, what?
Yeah, I know.
Not where I thought you were gonna go.
Right, I thought it was a neat story.
That's an awesome story. I love that it's helping animals too. I didn't even think about animals needing a crown. But.
Right.
And especially, you mentioned having to be quick. In the case of a lion, you'd probably want to get in and out.
Right. Even with sedation.
Right.
Right.
Quickly
Just in
is
case.
key here. Yeah, absolutely. So today we're going to be talking about something different. So topic is not just PMS and hot flashes. I have no idea what this is about. What are we talking about?
Oh, women and hormones.
Okay.
Everybody's favorite
And
topic.
dentistry?
Yeah.
Oh yeah,
Okay.
yeah. Not
Let's see
only
the
do we have to
connection.
worry about PMS, and hormones can affect the mouth as well during different changes in our lives, and different hormonal changes in our lives.
Interesting.
So
Okay.
you might wonder what those are.
Yeah, absolutely. We'll find out.
Yeah. So one change definitely is pregnancy.
So yeah, so talk to me a little bit about pregnancy. What kinds of risks are involved? Now, you usually talk about gum disease a little bit. So
Yep, right.
let's talk about that.
And that is the one risk during pregnancy with the hormonal changes that occur. Women that are pregnant have a higher risk of gum disease because of their hormonal changes, mainly gingivitis. But of course, gingivitis, if left untreated, can basically turn into periodontal disease, so something more severe.
Yeah.
And so we really encourage women, and especially pregnant women, to care for their gums and teeth, extremely well during pregnancy.
And that's interesting because it's a common question of should I even go to the dentist when
Right.
pregnant? But actually you're saying it's almost more important.
It's very important to maintain regular visits. If regular treatment is needed, treatment for gum disease, we do it during the second trimester.
Okay.
We usually delay any surgical procedures until after pregnancy. Certainly we wouldn't want to leave gum disease untreated, so we would treat that during the second trimester.
Okay. Good to know.
That's interesting. So hormonal changes, does that change like the acidity in the mouth? Is that why?
Well,
Or-
hormonal changes can cause inflammatory changes, and as we talked about earlier in a few episodes ago, inflammatory changes are really one of the largest components in periodontal disease, so causing inflammation.
So what are the other critical periods in a woman's life that we have to worry other than maybe pregnancy?
Menopause is another one. So menopause, as everybody knows, well, I think we all know, causes a rapid decrease in estrogen levels, and that basically can cause a lot of problems with women, one being bone fractures, and another, it can put us at a higher risk for gum disease. The researchers have found that.
Great.
Great, right.
I know,
All
I
these
know.
fun things we have to look forward to.
We do.
So what are your specific recommendations? I mean, for Jessa being pregnant or for someone going into menopause?
I'm glad she didn't point at the
Right. Well, we want to make people aware that there is a risk, and certainly that this is an important time in their lives to make sure they have great oral hygiene. They visit their dentist regularly. Like we've talked about before, there are no symptoms of sometimes no symptoms of gum disease for some people. In the pregnancy case, basically we want to be sure that we prevent any low birth weight or preterm infants. So we want to get the gum the gums in optimal health to decrease those inflammatory changes.
Sure,
So much to think about.
Are you
Right.
doing enough, Jessa?
I hope so. I'm gonna go check my dental records after this. But
Yeah, I hope
no,
so too.
Yeah, and I actually read that early on that it was important to go to the dentist, but I
Good.
did not know why. So I appreciate the why behind it.
We always
Good.
learn so much from you.
Well,
I
thank
can't
you.
wait
I'm glad.
until our time is already out.
Okay.
But it was a pleasure to have you.
Thanks for having
and,
me.
stick with us. We're here at the Pink Poodle, and up next we have Orange Shoe Personal Fitness. Stay tuned.